So before we get into this episode, here's a little bit about it. There's a specific flavor of hubris that shows up when tech people enter healthcare. In the product management world where I used to live in, I would often kind of like put out an olive branch of saying, hey, I know product managers tend to have what's called product hubris when working with clinicians, that's doctors, nurses, support staff, et cetera, et cetera. And when it comes to health insurance, this hubris often sounds like brokers are just middlemen getting rich off of a broken system. We are going to go direct to the employer. Our guest today, Nick Soman, spent years building Decent, a health plan designed around direct primary care, and he watched a lot of smart people make this exact mistake. He also made some of them himself. This episode is a map of those wrong turns. Nick is the former founder and CEO of Decent. Now he is the chief commercial officer at Nice Healthcare. Decent and nice, nice and decent. The press release writes itself. I can happily say that Nick lives up to his two companies' names. Let's get into it.
Cool. You know what? I skipped a part. I forgot to ask you to introduce yourself. Can I ask you a quick intro? Who are you? You mentioned Decent. What parts of healthcare do you currently occupy? And, your past.
Yeah, happy to talk about that. So I'm Nick Soman, and I was previously the founder and CEO of Decent, and we built health plans around direct primary care. And before any of that, I was the child of two primary care doctors, and I heard more than anything else at the dinner table growing up about my parents' appreciation for the compassionate patient care they delivered. And then as they got a little bit older, they got a little bit more frustrated with their careers. They both went into executive leadership after doing primary care at Group Health Cooperative for 30 years each. And then they would get frustrated. And we talk about how the insurance folks in their HMO were making it difficult for them to practice patient care. So I watched them get so frustrated with their work, Alex, and I watched them feel disheartened. I watched them go from being total idealists about the idea that, we are doctors and we're going to help people, we're going to save this, to really feeling like they were, to some degree, the puppets of these financiers in terms of insurance. And so that was sort of brought to head in a moment where my dad came home and he sat down at the dinner table, and I was probably 12 years old, and he said, I just don't think that my insurance counterparts at this HMO care about the patient. And that was the moment that really radicalized me. And I said, I don't want to go follow in my entire family's footsteps and be a primary care doctor like everybody else, because I'd watched that he didn't want that job anymore. And so started Decent. We built these plans around direct primary care. As you know, we recently sold Decent to a really exciting company called Nice Healthcare, where I'm now the chief commercial officer. I can't talk about the future because of my privacy and legality, but I'm really, really excited to do some of the things we do well and do some of the things they do well and put something really exciting in the world. So I'll leave it at that.
In my research, I read your post and you said decent and nice, nice and decent. The headline writes itself. And I was like, could you ask for a better partnership?
The thing is, it's true. I mean, I've known the company for a while. I was a little angel investor, so I've been tracking them. And they've got this incredible primary care experience where nurse practitioners will come to your house and deliver care for you and your family. And then they've got virtual care when you need it as well. I think it's really differentiated. So more to come on that. But you asked me where I occupy in the world of healthcare. I guess it's funny that I'm saying this because I am ultimately so pro primary care and I want to create a good experience. I just don't like it when people waste their time. And so it's just so easy to waste your time by not thinking really clearly about the things that are going to make a plan stand out in the early years. Once you've got something that's out in the market and you can really sort of iterate and differentiate, that's great. But most things die far before that step.
Yeah. I know you can't comment on future plans, but I think there may be a world in which you merge with Kind Bar, the packaged snack brand company, maybe like a food as healthcare sort of play. And then you're nice, decent, and kind.
We're just going to collect all the good adjectives so nobody else can be good. I like that.
Yeah, you'll be the meta, or excuse me, the alphabet of goodness.
Yes. I don't like to pervert words, and so hopefully we will not be the meta.
Yeah. Okay. Sorry.
Definitely.
Just in corporate structure.
Okay. It definitely made things a little easier. So I'm with you.
Yeah. Okay, cool. With that, we're going to talk about commercial health plans. And that was the original scope of Decent. It is my kind of like a little bit of my heart when it comes to, some healthcare experience or experience working in healthcare that really got me excited. And then we're going to talk or bring in the niceness maybe towards the end to patch in some of the things that I learned towards my end at Sana. But we're here to talk today about you can put all this work into crafting this beautiful gem of a health plan that you really believe in, and you will be, I think, incentivized, or the type of people who create this plan are also the type of people who are going to say, oh, we see all these brokers and they are part of the old system, and so we are going to try and sidestep them. We believe that similar to, the way that we have PBMs, that brokers are kind of like extracting a bit of a rent seek here in this place, and we are going to sidestep them. They're going to take, this company is probably going to take then 2 years, 3 years, maybe 1 year if they're smart, or not smart, if they're reevaluating consistently and realize, right. Oh, maybe there's something here where we have to dig into. So
let's talk about it, because I think it would be probably a little bit oversimple to say that brokers are a necessary evil. There are people that will tell you that, and there are people that will say like, yeah, you're just not going to get them unentrenched. But I actually think there's a specific hubris of technology people that I can point a light at a little bit. They hear about brokers, and the job of a broker is, there are lazy brokers, there are bad brokers, but the job of a broker is not inherently an easy job. You have to stay up on all these things that are happening in your market. You have to sell to a group of people that's going to be innately skeptical. You have to work with some of the largest and most annoying organizations in the world at the carrier level. And so when you meet that new person, and unfortunately it's normally like a white man running a tech company who says, brokers are just middlemen, we don't need them. What that person is missing is that they're fulfilling a trust role. And here's the thing that person doesn't want to hear, but I'm going to say it out loud. No one trusts you. No one trusts you. So you might think, well, I'm a tech guy and I have these great ideas, and I have made my own mistakes in this world. So surely I don't need to work with these middlemen. I can just get people to trust me. But the majority of people who are out there on Main Street that are looking to buy a health plan, they're not going to look at a shiny website and go, oh, wow, we can really trust this person. They're going to look for some form of third-party validation. They're going to talk to their brother. They're going to talk to their brother-in-law. They're going to say, do you know anybody who knows about this? And they're going to get connected with someone. And probably they're going to work with a broker that actually knows what they're talking about. So to that tech wonderkind, and I was that, and I think that you came from a company where there was some of that, and almost everybody who gets started in this space makes this mistake. You sound like, I don't really feel like I should be dealing with the middleman of the Facebook ad platform. You know what we should do? We should just build our own ad platform. Don't reinvent the wheel.
Right.
There are people out there, and they can also teach you something. That's the thing, is there's so much hubris that comes in. But the great thing about brokers, and this is how I've learned to love them, I can pick up the phone and call 50 brokers, and they will pick up the call, and I will ask them questions about how we're doing, what we might do better. I just did a huge survey on this, and they'll tell me. Think about how amazing it is to be part of an industry where you can actually ask questions and get answers on what it's going to take to sell. And so I liked how you framed it. If you go down that road early on, it's probably ego leading you there. And then the question, is it going to take you 1 year, 2 years, or 3 years to get out of it? I would highly recommend that people embrace brokers from day one. They aren't the only way to sell, but they are the majority way to sell. And they can teach you something in those early years just as much as they can show up and be a channel partner for you.
Yeah. Let's talk about 1 to 2 tips that we have learned about how to sell a innovative commercial health plan. What do we think about that? That segue.
I like that segue. Let me throw a couple things at you. So I think that in order to do this job well, it really, really helps to simplify the problem.
Yes.
And one of the challenges is there's a lot of different stakeholders involved in building and selling a health plan. You've got your stop loss partners, you've got your vendor partners, you've got your teammates, you've got the employers, you've got the employees, you've got the employees' families, you've got the brokers. It's really a lot, right? And so the good news is you can really, really slim that down. If you can't sell to brokers, you have nothing in
Okay.
this world.
Yep.
If you can sell to brokers, you definitely have something. And it's not sufficient, but it is necessary. So I would start by just sort of saying, that's who you really got to convince. Because if you can convince the brokers that you've got something that's worth their time, then the question will just be how much you sell and then how much better you can make it. I see a ton of companies that go out there trying to sidestep the broker. They don't understand the role of the broker, and they don't do the work to figure out what will make this thing sell. The funny thing is, Alex, those same people, they often come from more traditional tech, which I did before I got into this business. And they will happily talk about cost of customer acquisition. They will happily talk about CAC and LTV. And yet the idea that you might give a human some money, to be able to bring you business and to create trust with these prospects that you probably can't create with a website. Sorry, but you can't. It seems anathema to traditional tech thinking, but I mean, I think it's sort of the simplest idea in the world. These are people out there, they touch, in my estimation, about 70% of small to mid-sized business health plan sales. And so you're wild not to look at them and wild not to talk to them. So that's the first thing I would offer is ignore everybody else and make something really for the broker, because that's what's going to work for you. Second thing is, I'll simplify it further, including with brokers. If you don't have price a good percent of the time, again, you have absolutely nothing. And I am being a little bit hyperbolic, but I really believe this because I see too many people making a mistake and kind of going, well, what people really want is they want the world's best network and the most incredible coverage. And can you believe this AI technology? No, stop it. Just stop it. Because these brokers are being beaten over the head day in, day out with clients that are going, can you get me some rate relief, please? Can you get me some rate relief first? And then if you say yes, I'm going to ask you to prove to me why it's actually any good. Show me why it doesn't suck. But if you come to me with some fancy sounding doodad or, the world's first AI primary care
navigation,
but it's not
yep.
cheaper than the thing I have now, it's not a conversation I'm willing to have with you, let alone a product I'm going to buy. And so I give you those two heuristics. Focus on the broker and find a way to make it cheaper for at least, I'll pick a number, 40% of groups. If you can't do that, then figure out how you can.
I was thinking, for the sake of this, we should just wave a magic wand and live in a world where we have the health plan locked in, right? Like, we got to reinsure. We know how we're going to model and pool risk. Like, we have a plan design that we're reasonably comfortable with, like 3 PPO-like plans and 1 HDHP-like plan. And we have, some tech people, building a software product that allows employees and employers to make whatever plan election changes that they want. And also, they're good product managers and designers and engineers. So we actually also built, like an integration to a payroll provider and things like that. So we're like leaving those off to the side, and we're going to talk about you can do all that work and you are still going to fail if you have not thought about brokers and how to make you said rate relief. And I want to confirm, what I have in my working definition, which is kind of like the monthly premium for employee plus spouse, et cetera, times the number of employees who elect and dependents who elect, and times 12. Is that accurate?
There needs to be a good chance that it's cheaper. You can simplify it a little bit further. You could just look at what's called the employee-only rate, which is the rate for just one employee on the plan, because that tends to be the number that brokers index around. And actually, there's all kinds of games that get played. So people will show a really low employee rate. It'll turn out that they'll bump up their employee and child and employee and spouse, employee and family rate. But that's still the right number to focus on.
Okay.
I want to come back to what you said, though, because I think, yes, you need different plan designs because you need to make something that's commensurate with what people understand. I've seen way more people over-index on software than under-index on software in the early stages of trying to solve this problem. And here's why. And I think it will actually check when people think it through from first principles. It's because you do not want to interact with your health plan more than you have to. Bottom line, period. So if you think about a mapping software that you might use every day, I use Google Maps probably 3 times a day because I'm going out and I'm getting my kids and I'm taking people places and I'm wondering how far away something is. If they made it even better than it is, if they made it 50% better, maybe I would use it 4 times a day. There's still a cap on how much more I could want to use it. But when you look at your health plan, think about all the horrible things that have to be true for you to have to choose that interaction, for you to have to go, oh God, even if the company behind it didn't suck, right? For you to have to say, okay, wow, we'll talk about Decent. I'm going to give Decent a call. You're not doing that if you had a nice day, you just felt like talking to somebody nice. You're doing that if you have a significant health issue or a health issue in your family. You have not been able to self-serve the answers to your issue. It's time sensitive and painful enough that you want to handle it. So I think it's entirely the wrong way to think about it, to go, well, how can we build innovative technology that'll transform your relationship with a health plan when 9 out of 10 members of a health plan will go, do you have a way for me to look at my card? Okay, that's what I want the app to do.
Right, like I'm the member, right? I would prefer not to be here.
Right.
I would prefer to be living my life, doing all these other things, and yet I am here.
That's right.
Like, how do we minimize the amount of time that I interact with you, health plan? You know, like a thing that I often have to kind of like deprogram product managers about is we are not a DAU or an MAU business, right? Like we should be optimizing for less usage. Yeah. With all of the kind of like asterisks there, we are not trying to make it so bad that people never use us, right? Which is actually a common move in health insurance with utilization management.
Yes, but there is an alignment of incentives because I've done this research. If you ask 9 out of 10 members of a health plan what they want, they'll say, oh, heck yeah. I don't want to. Think about trying to build the world's best dentist office. Okay, you might have done a great job. Maybe it's twice as good as the other ones. Are people going to go get more dental work? Probably not.
Yeah.
You're going to maybe appreciate it when they have to be there. But that's really what you're looking at with a plan. And so it's not that the software doesn't need to exist. It's that it's really easy to wrongly pretend that's where you're going to differentiate. That's not where you're going to differentiate. You're going to differentiate on experience to some degree, but also on cost and price.
Yeah. Okay. Speaking of, 1 to 2 tips, let's talk about 1 to 2 tips that we have learned about how to sell a innovative commercial health plan. What do we think about that? That's segue.
I want to throw one thing in there though, because there's something you get for free if you really listen to me. If you listen to me when I say to you, if you don't have price, you don't really have anything, then you figure it out, then for free, you get some element of making the world a better place because there isn't a way to build a successful product that is also cheaper and be a true shitbird unless you're just finding a way to completely yank any value out of the plan, and most brokers can see through that. And so I would just put that forward too, is yes, you want to look at good risk. At the end of the day, like I might talk big, but I really want to do something good in the world. And I find it to be a really welcome design constraint that nobody's going to buy something from me if it's just more expensive. So, to your point, like, yes, there's an element of plan design. You have to get really clever about what are the things that are going to significantly reduce the cost and help people manage equivalent risk better. And it's not infinity number of answers to that, but the nice thing about being in this space with these constraints is if you can't figure that out, like, go home.
Yeah.
And then you're probably doing something good.
Or try to do this in a different kind of like industry or vertical, right?
Right.
Yeah.
Right. If you want to make as much money as possible, there's way better places to do that than health insurance.
Right. So
yeah.
Talking about channel partner makes me think about something we talked about earlier, which is, the typical tech way to think about this sort of thing is CAC, right? You would say, one might say, hey, we are using brokers as our distribution channel. There is some percent that we pay to them in commission, which is a thing that happens in all of insurance. One side note for the listener, your insurance broker is likely to get paid by your insurance company, not you. That is a thing that often happens. And there's a side conversation that maybe we can have later if there's time about incentive alignment there and what that means for brokers. And if you are a consumer or likely an HR person at a small company who has been tasked with trying to find insurance for all of your employees, that is maybe something that you should have in the back of your head. But let's move back to this kind of like how we think about the money. We may think of it as CAC, right? And your tech, with your tech hat on, you'd say, why don't we just take that money, that 3% that goes to our kind of like customer acquisition cost or COGS, and put it to paid ads? And that's not really the way to think about it, correct? Because,
yes, that's
and
right.
why is that?
For a variety of reasons. One of them is that if you incentivize brokers appropriately to sell your thing, then they'll start bringing you business hand over fist. If they've got a large book, then it's not like on Facebook where your CAC creeps up as you get the low-hanging fruit, and then after that you get the slightly tight fruit, and after that there's no more fucking fruit.
The channel gets more efficient with brokers, right?
That's right.
As opposed
and
to
they talk to each other. So that's a piece. And the other thing is, if you can build a good reputation with brokers, maybe it's 3%, but quite often it's like 5%. It's like 5% of the total premiums are going to go to the broker. Now, I've been in enough industries to know that if you told me that I was, even in perpetuity, and people don't always do this, I was just going to have to pay out 5% of the revenue I could get, and I'm making some simplifying assumptions here, that's a crazy good deal.
You're like, I'll take
and then
that.
I could quadruple down on that channel and not do the whole thing of fuddling around and trying to find, 7 other things that might sort of
I've
work.
paid way more for worse marketing.
Completely. Yeah, I think that's right. Yeah, throw a single event and have 5 leads from it, and then come back to me and tell me that it's not worth working with these people that do this for a living. It's just hubris.
Yeah.
That's what it is.
Yeah. Okay.
Yeah.
What does it take to, what do you need to do to build things for brokers? So now we're kind of like one step in. Hey, you have convinced me that my original stance on no brokers ever, we're going straight to consumer, we're going to own the customer relationship, and we are going to be good at preserving that, and we're not going to be kind of like beholden to the broker's kind of opinion, or where they are getting maybe better commission rates from that affects our churn. So I'm one step in. What do we need to build? What do we need to think about?
Purely put yourself in the shoes of the broker. And I think you got at one of the two sides of the broker equation. The side that you got at was, where can I get the highest commissions? And it would be a lie to pretend that most brokers don't care about that.
Sure. I go to, or negotiating a salary is a thing that happens when I find a new job. And if I'm lucky enough to have multiple offers, I'm going to be playing them against each other.
That's correct. But now let's look at the other side of that fence, which is, imagine that if one company offered you $300,000 and the other one offered you $250,000, but they said, Alex, the cool thing about this offer that's at $250K is this job is actually easy enough that you can get 2 jobs. That other $300K is going to require all of your time. But this $250K offer is only going to take 50% of your time. Now, you're an industrious young man. I mean, you understand. You can go and find another job, and you can be making $500.
I'll be the next Soham Parekh of the insurance world.
That's right. Don't break any rules and disclose. But remember, for brokers, when people say time is money, they really mean it. So a broker can make way more money if you can hand them a product that's easier to sell. So even if the dollars associated with an individual sale are a little bit lower, if it takes them 1/3 the amount of time, or if you're able to convince people that the close rate on this is going to be significantly higher than it would be on the traditional thing that they sell, then the math still works in your favor, because it's ultimately an ROI calculation, not just a revenue calculation. So that gets at how you think about building this. And this is where I just have this picture in my head of these whiny, entitled tech bros that are like, oh, aren't offering any value, because those same people are going to complain that all the broker did was sell this thing that was really easy for them to sell, but they're again missing a step. The broker will tell you. They will tell you what they want to sell. A customer is not able to do that in a meaningful way. Now, you're going to have to work and innovate a little bit, but this is the coolest thing about working with brokers. When they don't like your thing, they'll tell you why. They'll tell you, I couldn't sell this. I can sell ice to an Eskimo. I couldn't sell this. And here's why. It's an incredibly efficient research channel, let alone a sales channel. And so the greatest thing is you call them up and you talk to them and you ask them. And in order to be a good broker, you have to be available and you have to be able to pick up the phone, which means, unlike every customer in the world, they make it easy to reach them. You can go on Yelp and you can find really well-reviewed brokers in every city in the country that are waiting to pick up your phone call. And if you have something interesting to say, I wouldn't recommend doing it during Q4 because that's when
Right.
they're really making
Yep.
their money. And they're going to talk to you. And again, if I sound a little exasperated, it's because I am. It's not that these people are saints on earth, right? Neither are tech people, but it's such a tremendous advantage to be able to go talk to them and get really clear answers about what's working and what's not. And yet we act like, oh, they're just a middleman, and somehow I'm just going to go and figure this out on my own. It's such an inefficient way to use resources.
Yeah, there's a part of what you were saying where I'm a millennial picking up the phone. I hate it. So that's something that brokers got. One of many things that brokers have on me. It is not being afraid to pick up the phone, which I have to recognize in myself.
Make it, then do it the other way. Make a great website, show it to the oldest person who works in HR that you know, and ask this person, would you be willing, without the help of some third party,
Right.
such as a broker, to make a buying decision on the basis of this beautiful website? They're not even gonna take your call.
Absolutely.
That's
not.
what's gonna.
Yeah.
Yeah.
I was in the position where I had to look into some business insurance for us, right? So like, this podcast, I was looking at E&O, errors and omission. And I was going through all these websites, and there are some fancy ones these days, kind of like doing the whole, where we're recreating insurance. And eventually I just had to call an agent. and I did the exact same thing that you were saying. I asked people in my network. I asked my brother-in-law, who has started his own company, for recommendations for more what I would call exotic types of health insurance. So like just pausing there to reflect on, actually, I also did not even go through the research or buying journey on my own just from a website. I think is important to take into account.
It's just really hard to do. And I'll complete the bookend to this, which is that you want to learn about this and you want to put yourself in a position to understand how to sell. You're probably going to need to get a broker license.
Yep.
Like that's a thing that I did. That's a thing that Will did. That's a thing that a lot of people do throughout this process. Here's the funny thing. People found out that I was a broker and they asked me two questions. The first was like, oh, you're a broker. Does that mean you can like be my broker? Like you can do this stuff for me? And I already knew what I was doing. So I was like, oh God, I don't know. I'm kind of busy.
It's like you never tell people that you're good at Excel, because after that they're gonna send you all of their Excel shit. You say, I'm okay at Excel. That's what you tell people. You never say I'm good at it.
At least, that's right. I love Excel, but at least you get some nerd points for being good at Excel.
Okay, fair.
This is the second question, and they didn't ask it explicitly, but I made the mistake of being like, okay, like I can help you out a little bit, da da da. And then basically like find a way to ask me like, can I still trust you? 5 minutes ago, you were my close friend Nick, who I went to college with, who I know knows this stuff like the back of his hand, but now you're a broker. And it was like, oh God, like I guess I'm saying like have a little bit of empathy for these people because most of them are good people, and just by stepping into that category, the level of hackles that get raised, especially from traditional tech folks, is sort of absurd, to the point that I started just saying like, I can help you. My preference would be not to. I can connect you with somebody who could be better at this, because it's not an easy job, and these folks this is a positive thing. Think about all of the frustration and the doubt and the skepticism that goes into the conversation we just had for the last 10 minutes. Now imagine just showing up and being like nice to those people. If you do that, you really stand out. If you do
Hearts and
that,
minds.
they will go to war. That's right. That's right.
Yeah.
So before this job, I was a product manager at a health insurance startup. And there we were on the receiving end of what's called benefit verification calls. And this is the doctor's office calling the insurer to ask things like, is this patient covered? What's their current deductible status? Do I collect a copay today? And for you as a patient, this is what your doctor's office is doing when they ask you for your insurance 2 weeks ahead of the appointment. And it's worth noting that these calls are endless, both for the provider side and also for the insurance side. And each one starts the same. I'm calling for patient Alex Doe, A as in Apple, L as in Lima Bean, E as in Excalibur, and X as in I just broke up with my ex. I am sad, please hold me. And my big product win there was building a chat widget so that the provider side could just type it out. And I have to be clear here, this was a legitimate win because our support folks could handle 3 simultaneous chats or DMs instead of 1 simultaneous phone call. And boom, 3x efficiency gains. And in retrospect, it's a little embarrassing because all this should really have been running over APIs from the start.
Which brings me to our sponsor today, Steady. Steady is the modern healthcare clearinghouse. You can verify insurance, submit claims, track remittance, all through developer-friendly APIs and best-in-class infra. No phone trees, no transcription errors, no thinking of what letter the phonetic NATO alphabet corresponds to. And every customer gets a dedicated Slack or Microsoft Teams channel, God help you if you are the latter. And average response time is under 10 minutes. I don't know if Steady existed when I was fighting for that little win at my last company, but gee, I wish it had. Go to steady.com/demo to get started. STEDI.com/demo. Another way to remember it is like Saint Eddie, the canonical saint of EDI, which is who I would have prayed to when I was working at this startup. Okay, so now I'm 2 steps in, right? I'm thinking, okay, now my roadmap, I'm changing things up, right? If I want, I've done the layer of product management work where I'm like, okay, I'm not just blindly going roadmap stuff. I am oriented with the top level direction of this company, which is probably to make more money. And then asterisk for insurance, we want to make more money writing good risk. So not just sheer volume writing whatever level of risk that we or business that will come to us. What do I need to build? It's not the first thing that comes to my mind is a feature that came across my desk, which is, hey, we need to have a broker login, right? So that they can administer benefits for their clients. That's not what we're talking about here, is it? Okay.
No, it's not. That's not what we're talking about. Here's the hard part. This is really the hard part. Is you have a few challenges, but now at least you're oriented the right way because you know that if the brokers don't give it the go-ahead, you got nothing. Now let's talk about what they're actually saying yes to, and you're going to find again, for a different reason this time, you have to simplify the landscape because they have to go sell something, and they need to sell something that the average person who works in human resources, who would really, really rather not be having this conversation, who once a year has to do this, least favorite part of her year, and maybe doesn't even really particularly like or trust these brokers and understands that insurance companies has a bad rap anyway. Think about how simple the message has to be for that person to get it and want it. And so this is the next thing that I would say is throw out anything and everything that is highfalutin from a member perspective. Now, there might be some really interesting things that you can do to segment risk behind the curtain. There might be some brilliant things that you can do algorithmically. There are ways to use AI to evaluate and segment risk better, et cetera. But from the perspective of what that broker has to go tell that HR person, it better be freaking simple. And so at Decent, we found a plan that was called the Zero Plan. We like to name it what they are. It's called the Zero Plan because if you do what the plan wants you to do, it will cost you $0 outside of your monthly contribution. And that might seem oversimple to you. That was the result of 4 years of going, wow, we just have to make it simpler. We just have to make it simpler. We have to keep making it simpler. And so whatever your hook's going to be, it needs to translate from a marketing perspective to here's the one thing that you need to know about this plan, and it should get you nodding your head and saying, okay, if indeed they were able to provide that for me and it was cheaper than comparable coverage elsewhere, then yeah, that sounds like something that people would like. And so people like free, people like simple. I think there's a big element of that. What I see people doing too often is trying to come up with really fancy tools that allow you as a member to self-serve to the right orthopod clinic. And what anybody who's been around this space will tell you is just go ahead and write off anything that involves more than 20% of members self-serving anything. You know, you really just have to make it damn simple to do the thing that you want them to do. And if you do that, then maybe
then you even have a chance to be in the consideration set, right?
In the conversation. That's right. And a little bit of secret sauce that I'll spill here, because I think it's pretty important. Mm-hmm. I am a big believer in this direct primary care movement. I think it's ethically and philosophically aligned. At the end of the day, I'm a kid that didn't want to go be a primary care doctor, still wants to make mom and dad proud, and that was what they did. And so that's really real for me. Now, the math checks out that it's going to be cheaper to handle your everyday care through primary care than going to the hospital every time you have a cold. Only an idiot would not understand that. And so that changes the first question a little bit to, okay, where am I going to get my everyday care handled? If you can come up with a really good, thoughtful answer to that question, and the math's available online, you can go find it. Go figure out how you're going to do that part for cheaper, but don't stop there. This is the second thing, and I would argue if you can put these two things together, then you have a real chance. The truth is, the math of a health plan is really written in what's called steerage. Steerage is where people go when they need non-primary care, particularly when it isn't a true emergency. And why do I give that caveat? It's because I think it's the ethical thing to do to say, if you have an emergency, don't be looking at who's in network and who's not in network. If it's a real emergency, you go and you get the care you need. But there's a huge, as in like majority dollars, amount of variable expenditure where if you go to one MRI in Austin, Texas, you go to a different MRI in Austin, Texas. I did this math myself. The top 10% cost MRI, what's called the top decile, and the bottom 10% cost MRI in Austin, Texas, in a particular network, had an 8x price variance between them. So similar block. Like you could walk down the street, or you could walk down the street and go one block further, and you're going to save 80% on your health plan.
May I ask, what is that? Is that $100 and $800? Is that $1,000 and $8,000? Just from a sheer
for an MRI, it's going to be closer to the 1,100 spread. Okay. These are all numbers that are directional. But what you need to understand is, for every shoppable service, you're going to see some version of that spread. And what's crazy is, what that means is, okay, find a solution to your everyday care, and then figure out, and this is a trickier one, and I probably can't share too much about this because there's some really cool stuff we'll be doing with this, figure out how to make it true that people come to you when they need guidance about where to go. Now, there's lots of ways that you probably won't make that happen. If, for example, you lean too hard into AI and you go, we're just going to use ChatGPT for everything, here's what you forgot. Not everybody, but a lot of people are still going to go, well, I still have my one primary care provider, and I might give her a call. And as soon as they're doing that, they're not doing what you want them to do. So you have to really think about, yes, where am I going to get that everyday care? And how can I put myself in a position to have a say, maybe not total control, but have a say over where people go when they need that steered care. If you can do that, then suddenly the opportunity is really going to start to open up for you.
Steering requires like a lot of data, right? Like to be able, you mentioned price and price transparency, price data, to be able to actually say, hey, for this member, for imaging, for this specific modality of imaging in this zip code, these are the spreads, right? And then you're going to have enough data to be able to say, well, for this next zip code, one zip code over, not to mention whichever number of states that you want to launch your plan in next. That then,
Alex, I like you're doing the tech thing.
Oh yeah,
I'm going to push you. You're doing the tech thing. You're envisioning a perfect system, and you're totally right. And then you're next going to poke holes in how it's hard to get to there. You're totally right. It's absolutely hard to get there. So we believe that's coming. And it's coming year in, year out, and these price transparency laws are starting to grow teeth and starting to have a little bit more data behind them. However, so if you can't get all the way there in the first year, start thinking in terms of heuristics. Again, the math is available. Think about things like, if somebody needs a hip replacement, do I want them going to a hospital or do I want them going to a standalone surgery center? And what I would tell you is 4 times out of 10, you want them going to the standalone surgery center. And what you've done there is you've said, here's the ground truth about what costs more and what costs less. Now, could you iterate on top of that and get 10% smarter, 15% smarter? Sure. And as the data supports it, you could do it. But don't use imperfect data as an excuse to not find the baseline truths of this business.
Yeah. Don't.
Keep people out of the hospital. If you can do that, then you're making good progress.
Not a bad heuristic, right? For everything that could go to a hospital, do we have just written down internally at our company the set of things that they should do instead? That we're not.
Yeah, and I'm not trying to be a joker, but kind of like anything else. Can we give them any alternative?
Right.
Because if we can, we're at least going in the right direction.
Right. Yeah. Okay. And am I correct that all of this we do all of this work, this complex. It doesn't have to be like the pursuit of perfect data, right? That's one of the rules here, right? Like, don't do the tech thing and say we're going to build the perfect system. Instead, for the data that we have now, what are the rules and guidelines that we can give to people who need care? And it is better for all of us for them to have cheaper care.
That's right. And actually, just one rumination on top of that. In the end game, the harder part is not going to be availability of this data. The data is actually coming. Like, you can believe me or not believe me, but in 5 years, we're going to be in a totally different place from the perspective of transparency. The end game is going to be, how do you get people to do what you want them to do? And so that's where it pays to be really, really smart. And there's lots and lots of secret sauce there that I probably can't talk about, but think about how you make medical decisions and what it would take to change your mind and change your process, and you'll be barking up the right tree.
And all of this is one layer down from what we talked about at the beginning, which is it needs to be a thing that a broker is going to be into selling, right? That they're going to say, yes, I understand this, and yes, I believe that I can make money selling this, quite frankly, right?
Yes.
So in order to achieve that, you need to have a plan where a set of things for the product for the broker to sell that is easy to understand, such as the zero plan, right? Not this PPO 3000 silver, whatever, right? Not this, 1500 where the 1500 is the deductible, and then between that and the out of pocket, like all of that shit is the standard, but it's extraordinarily like bad experience for any user.
It's bad from the experience of the user. And the thing I think people forget, you won't even get the time of day from the broker. They're going to go, hey, you have 50 plans. You know what? United has 250 plans, and they have the better network. So don't build United Junior. That's the worst thing you can do. And if you can find the one thing that you're known for, that's much closer to the right direction. Now, you did say something earlier that I think is important. People don't spend enough time talking to the people that make these decisions, because if you did that, you would start to see things like, oh, damn it, I just wanted to offer one plan, but we probably ought to offer some sort of HSA option, because it turns out that in every company, there's a handful of senior executives that really like that HSA. We won't speculate on why they like it.
Maybe
Actively fight, tooth and nail, anything that looks like it's going to displace their beloved HSA. So there are a limited number of things you'll discover if you really lean into the buying process. They're not that complicated. People just miss them.
Yeah. Okay. I will say my mom told me you should always be on an HDHP plan unless your health goes like way different than it is now, and we hope that it isn't. But she's always been on that, which very astute from my mom.
She's smart.
Yeah. Okay, so we do all of this complex work to be able to build a product that we can say as simply as the zero plan. Like, yes. that is kind of like...
If you do what we want you to do, you won't have to pay any money.
Yeah.
Period.
Yeah. All right, I come from commercial insurance world, from the earlier ad, and risk adjustment was a world that I was just very blissfully ignorant of. Then I came here to Out of Pocket and started learning, holy shit, there's a lot here in the world of value-based care and Medicare, Medicaid, and things like that. So I am a strong believer that value-based care is how we back ourselves out of this healthcare morass, aligning incentives and sharing risk. But right now, if you are doing risk adjustment, even if you are doing it the right way, CMS, OIG, and the Department of Justice are putting everybody under the microscope. And that scrutiny is very real and very risky. Then also, at the same time, there's this changing tech landscape. So what I've been learning is that NLP and machine learning have been the backbone of automated coding and risk adjustment at scale. And now these LLMs show up, and we're not really sure why or how they work, but they just kind of do. And so naturally, you are probably thinking, hey, these things reason like human brains. Why don't I just buy smarter brains? Why not use Opus 4.6 Extended as my coder at scale? And why not 10 Opuses 4.6 Extended? We are doing this course April 7th through 9th with Rapid Inc. I will be moderating. We go into all of this and how to evaluate vendors flocking to this space, the changes that are happening from a regulatory standpoint that you need to know about. And if your revenue depends on risk adjustment, do not sleep on this one. Even hearing you say that, I have this kind of like resistance inside of me. Like there's a spectrum here that I think of, right? Like there's narrow network and ultimate choice, and America is ultimate choice, and narrow networks are HMO, right? Like, is that, did you run into any of that as you were like, did you have to make decisions on that spectrum when you were rolling out Zero Plan?
We certainly did. We did run into it. Now there's a good solution to it, actually, because that's absolutely a really valid comparison people will make. And there's a lot of people that just really don't like being told, you'll hear narrow network and then it's been rebranded to high performance network. But the bottom line is it's providers that are going to give you as good or better care, but it's not going to cost an arm and a leg to the plan, because ultimately that's the thing that will allow your prices to stay low next year. Right? You want your prices to go down, not up.
Yeah.
So, but if you go to people and you say, okay, I understand that you want your rich PPO plan and you're used to your United plan that you can go wherever you want. We have that too. We rented a network called First Health, as an example. There's 5 of them. And you can go, remember all that cool stuff I was talking about the Zero Plan? It's all the same. It's exactly the same. All I've done is I've said, here's our high performance decent network. And then over here, you can get it with the whole shebang, First Health network. You might have noticed it costs twice as much. And 9 out of 10 people are going to go, oh, actually, take me back to the one that I might be able to afford.
Yeah.
So
it's like, hey, I want a choice, but when I actually have to make the decision about numbers, I'm okay.
and the other thing that does is if they feel that they have learned to trust you a little bit, they start to see why these traditional plans outside of yours are so expensive. They go, okay, well, that was the only difference. Then, gosh, are we really willing to pay that amount of premium? And I'll just tell you, almost nobody will, because when you do that, what you're really paying for is, I'm willing to just take it on the chin for another year from this existing carrier, Blue Cross Blue Shield, United Healthcare. Nobody ever got fired for buying them, and I can go tell my team we're not changing anything. There's really not much of a chance that you're going to make that sale using that really rich network, but it's a good way to kind of cast that in relief so you can really get them focused on what you can do.
Mm-hmm. And yeah, like also just gear up for 13% rate increase next year. Like just
oh, right.
Do you have that in your budget for another 13% next year, and then the year after that, and then the year after? Because that's what we're trying to fight with the Zero Plan.
You may also notice these deductibles are going up every year, and so the costs are also being shifted onto your employee population. By the way, have you checked them with them? Are they loving that United plan that you're paying so much for? Probably not.
And it's the brokers who can have that conversation at the sale, right? Like you and I as innovative commercial health plan built by tech people, we think we're going to innovate and change everything. Like we are not even able to get in the room to have those conversations. And that is why it's important to focus on brokers.
That's right. And another, I feel like I'm just trying to give love to my broker partners here, but this is the other thing. The question isn't, can you get your buddy from college to buy your health plan? It's not, can you get your super tech savvy dad to buy your health plan? It's again, you come back to think of the oldest HR person you know, and I shouldn't have gendered that. It could be male, it could be female. They have no connection to you. And what's the thing that's going to resonate for them? And the reason I say that is because sometimes people get frustrated with brokers because they go, oh, they're saying all the right things, but then they just sell that United Healthcare plan. They're selling what the client is choosing. They're selling what the client is buying. So your year one podunk website looks like crap. There's no way to explain what the hell this thing does. And when I do try, it's really complicated and it has AI in it. Like, the brokers are not going to sell your crappy new product unless it's actually better. And there's no amount of whining or reading Paul Graham essays that's going to convince them otherwise. And so, this is why they want us to bring new options to the market. They really do. They're really excited about some of the stuff that we've worked on, that we will be working on. But they're not going to sell some JV thing just because they like you. And so I think that really frustrates people sometimes in traditional tech who are used to being able to just convince people to try their new thing. And this is where it comes back to remembering this is the lives and health of families. That's what you're really doing here. And so understand that when you're pitching them to sell your thing instead of that other thing, it's going to be a high bar. And as much as you might say, well, people complain about United, people don't like Blue Cross Blue Shield, but they feel like they know what they're going to get. And that level of mystery and uncertainty that can be so exciting in some parts of the startup world, think about putting your own kid on a plan that you don't know is going to be around in a year, and you'll understand why that's a tough sell.
One of the other things that I would always tell product managers is people are way more sensitive when your bugs mess with their families. It's fine for employee, but you fuck with the spouse, your bug messes with the dependents, like you're done.
Oh, it's so right. I want to give you an anecdote that really drills that point home. Honestly, it's one of the things that I look for because I make side bets sometimes and do some angel investing. If you're building a health plan and you're not putting your own team on the health plan, what are you doing?
Yeah.
You need to be some of the first adopters. And here's what will happen when you try. You're going to get like 40% of the team that's going to do it because that's what we're all doing. 60% of the team, 20% of the team that just won't because they've got, specific issues. And it's good to know that that's a thing. And then the other, did I do the math right? The other 40%, they're going to go, okay, I didn't know we were going to do this for ourselves. If we are, we really need to get a handle on pediatrics in my neighborhood. We really need to, take another look at whether and how we're handling vaccines. Like, they'll get really real with you because it's their freaking family suddenly. And I think that's, to me, that's a really good test of, are you serious about this? Because if you're trying to sell something you yourself wouldn't buy, I think you should give that another thought.
Yeah, absolutely. Okay, we've got 3 minutes left to this recording. We're going to go to the close. Anything to plug, Nick?
I don't know. I like my job. I work at Nice Healthcare. There's going to be some really cool stuff coming from Nice Healthcare. I can't talk about it right now, but you can always reach out to me. I'm N Soman at nice.healthcare. You can also reach me at nick@decent.com. The thing is, and I can tell you're like this too, these problems are so interesting that I love to explore them and rip on them. I expect to be trying to solve this set of problems for the rest of my life because it's really meaningful when you can even make a little progress. And we're all trying to build that treasure map to something that works better for everybody. And so what I'll plug is that this is really hard. There aren't, easy shortcuts, but I think there's a lot of meaning in the work. So I would really recommend that if you are thinking about it, you do it, but just do it with your eyes wide open.
Know that it's put aside the tech hubris and just get yourself ready for probably 2 or 3 failures, right? Just and try to race yourself to making them faster. This podcast is going to be an excellent compilation of them, so keep on listening. But yes, and just to drill it home again, talk to 5 brokers. Yeah.
Before you have an opinion on brokers. Just do me a favor.
Right.
Talk to 5 of them. Then I can listen to your opinion.
Yeah. And not you, right? Because even though you are a broker.
Don't tell me.
We'll strike that part out in the podcast where you said that you got your broker's license so that nobody ever comes knocking at your door.
That's right.
Cool. Let's see. I think I had a couple of lightning round questions, but I'm going to ask you just one for time. Any mantras that help you get through tough times?
Yeah, I think it's just really connected to the conversation we've just had today. One of my favorite poets is Rilke, and Rilke said, "The purpose of life is to be defeated by greater and greater things." So you said just a minute ago, get ready for some failures, get ready for some tough learning and race yourself through it. That's exactly right. You're going to take some hits. Get ready for that. Accept that. Almost embrace that because it means you're growing and learning, but do it quickly because there are still greater challenges to face. And I will tell you, I don't regret it at all. I've worked in all kinds of different industries. There's enough meaning here, and there's enough good that can be done for people, whether I'm ultimately the one that's doing it or not, that I really love it. But I would say the purpose of life is to be defeated by greater and greater things. None of us, including me, wants to lose, but just making sure that every failure is just a little bit bigger and smarter than the last one. You follow that path, you're going to get somewhere good.
Love it. All right. To greater and greater problems. Nick.
To greater and greater problems, man. I really enjoyed this. Thank you.
Oh, me too. Yeah. Thank you for taking the time. All right.
All right.
See you later.
Sure.